One way the UK's response to Covid has been world-beating is how effectively huge research programmes have tracked the epidemic. And today, a study of 155,000 people in England provides more vital insights. According to the REACT-2 study, the first wave infected 3.4 million people, and it now appears just as many have caught Covid during the second wave this winter. The study's participants do a blood test that checks for antibodies, which show if their immune system is primed to fight off Covid. Today's results are the first to include the effect of vaccines on antibody levels in the population. One key finding has been the effect of vaccination after infection. Following 2 doses of the Pfizer vaccine, 91% of people generated antibodies ready to fight off Covid. But among those who had already been infected with the virus, a single Pfizer jab gave just as good a result.
It may be that in some groups it might be appropriate to delay a second dose of vaccine if they've had previous Covid. I think the decision as to whether that becomes policy is quite a complicated one and needs to balance off different aspects, including how simple things need to be to do them at scale. And one of the great successes of this programme has been how many people have been vaccinated so quickly.
France's health authority has recommended delaying second doses for people who've had Covid. Canada is considering it too, but a GP coordinating the rollout here says it would damage trust in our programme.
We're doing amazingly well at the moment in rolling out the vaccine. We have 3 very important elements of it: sufficient supply, very good mechanisms for getting it in, delivering it into people's arms, and huge public confidence in it. Why would we put any of that at risk?
In fact, the REACT study also measured confidence in vaccines, and a very high proportion, 92%, reported they would take the vaccine or already had. However, among black people and young adults aged 18 to 29, confidence, though still strong, was noticeably lower. Reaching everyone with information about vaccine safety remains a work in progress then. But today's research adds to the evidence about how effective they are proving to be. Catherine Jones, 5 News.